Usually the patient, when they came to us, we have enough time to see them. Usually GPs have only 10 minutes to see you, so they don't have much information to take in 10 minutes. For us, we have like at least half an hour time to see the patient. So we take a detailed history, a good examination, and if they need any investigation, we provide them. And we work out like a differential diagnosis, what's the most likely cause of their pain. And then we do the medication review, we provide them with advice.
The pain is incredibly complex. It's not that easy anymore. It's not one structure, one surgery, one cut of a nerve or one thing of removed and it will gone away forever. It doesn't. Everything works because it's an alarm system. It's a prediction monster. Every time you have something, it predicts what's the next thing going to be, because you know what the last one is going to be, because what your friend has told you, what you had in your childhood, what your mother and father said when this happened, that's what's going to drive the next decision for you when you have another pain that's coming on. You're not going to be thinking this is the only reason.
We've just started in April our nurse-led IV lidocaine infusion pathway, so that the patient will be put forward by the consultant. This is suitable for you to have a lidocaine infusion. We run the first one. Our consultant will consent the patient to have 4 individual lidocaine infusions. The follow-up will be 10 weeks later. One of us nurses will phone, do the follow-up, if suitable, back on, carry on for the rest of them, okay? Won't need to see a consultant in that time for that particular pain.
So we need to work with our resources and we need to help. So our aim is to help people walking forwards in the journey that they want to choose and empowering people to do it.
So acute pain, less than 3 months, something that's new, okay? Caused by surgery or trauma, mostly. Okay, so obviously if someone has fallen over and broken their hip, that's an acute pain, or we've done some surgery, it's going to hurt, that's hopefully going to be an acute pain.
We provide acupuncture service as well. Unfortunately, it's not approved for back pain anymore, but we do it for other kind of chronic pain. We do transcutaneous electrical nerve stimulation, TENS, so we do it in acute and chronic pain. We give advice of this.
This is the most important, amygdala. This is the part in the back of your brain there which is responsible for fear, for crying, for your heart rate, for your breathing, for emotion. It's also the most important center for pain. And it's important because when you understand that, you can realize why when you're in pain your breathing goes up, your heart rate shoots up. But it also gives you the potential for thinking in the back there, why does yoga work? Why does meditation work? Because that calms that part of the brain down.
And we do have the Explore Pain Management program. So this program, we basically do it according to the guidelines that we have in this country. Basically, we have a maximum of 12 people. We have 1 introductory session, 1 pre-assessment session. The program itself is 10 sessions, which means 1 session every week, 2.5 hours, where we go through multiple strategies that help people regain ability to manage their condition, to be more empowered and to have more resilience dealing with their persistent pain. It's run by myself and another psychologist, and it's run in the Department of Pain Management at RBH.
Sleep, the research is overwhelming that 6 to 8 hours is what's required. We don't get that much. Some of you may be the 5-hour awesome guys like Margaret Thatcher, but realistically she got Alzheimer's.
The acute pain is the pain that should disappear after the tissue healing. For example, if somebody has a burn or a surgery and the tissue healing should be expected within 2 weeks, so this pain should be disappeared. But there's a time limit as well. If it's less than 3 months, it's acute pain. More than 3 months, it's chronic pain.